Please let me introduce our next speaker, and that is Dr. Lisa Goldstein, and she's board certified in both child and adolescent and adult psychiatry. She's had a private practice in Rosemont, Pennsylvania for more than 15 years and also provides consultations for school districts throughout Pennsylvania and Delaware. She has always had a special interest in children and adolescents with complicated special education needs, and this is expanded to include students with chronic migraine and post-traumatic headache. Dr. Goldstein is the president of the Pennsylvania branch of the International Dyslexia Association. She actively supports patient advocacy through her work with Miles For Migraine and the National Headache Foundation, and she's been fabulous to me with all of her help. Let me introduce you now, and her topic today is It's All in Your Head. Thank you.
Thank you.
Thank you.
Make that go dark.
Oh, sorry.
There you go. So what do I hit to make that go? Nope, make it go off.
This bottom button.
Okay. Hi. So I'm last this morning, and I'm going to give you part of the punchline first. I'm turning that screen off because the flicker is driving me crazy and makes me want to throw up. So you saw the picture. I'll show you the picture a little later on. So I am indeed a psychiatrist, and of course they want me to do all of psychiatry, depression, anxiety, and trauma in 20 minutes right before lunch. So we're just not going to do that. What we're going to do instead is talk about what it feels like and move on from there when your headache doctor, whoever's treating your headache disorder, says, "So dear, are you talking to anyone about this? Maybe you'd like to consider a little therapy. I'd like to give you the name of a psychiatrist," right? Many of us have had that experience. Thus the title of my talk, because our reaction is, what? You're telling me it's all in my head? If you would just get rid of my headaches, I wouldn't have these other problems. I wouldn't be anxious. I wouldn't be depressed. I don't need a therapist. I don't need a psychiatrist. What I need is to not have this headache disorder. And people come into my office feeling like that. People in my family walk into other people's offices feeling like that. But the truth is, most of us are here today, you're here today, because you still have a very chronic, difficult headache disorder. Has your headache gone away? You don't have to answer that. And what if treating your depression would make your life better? What if treating your anxiety would make your life better? Is it worth it to have a better life? And it's not as if our mind and our body are separate, right? We've maybe gotten past that. Of course it's all in your head. It's in your brain. Migraine brains, and I hesitate after Joanna's wonderful talk to use that word migraine brain because I now know that it's so loaded with so many meanings. But I'll go back to Dr. Schulman's talk. Brains that have migraines are more sensitive in many ways. And migraine is in your brain, and anxiety is in your brain, and depression is in your brain, and this is not your fault. You are not to blame for this. This is how you are. You have this thing called migraine, and you may have some of these other things as well for very, very good reasons. People who have migraines are sensitive to a lot of triggers. Thus, I turned that screen off because it was driving me crazy. And they react more strongly to these triggers, and they're more sensitive to these reactions. That's exactly the same for anxiety. I spend a lot of time as a psychiatrist explaining to people that you have anxiety because you have stronger reactions, and you're very in tune and more sensitive to these reactions. So when you start to get a migraine, and it might even be the day before when you start to notice, oh no, I'm getting a little tired, I'm yawning more, I'm craving chocolate. We now know that you crave chocolate. It's not the chocolate that causes the migraine. But when you start to get those first signs, or you realize my head's beginning to hurt, it's only 10 o'clock in the morning, I have so much to do. What's your first reaction? What's your first feeling? Now, you can't see my slide because I turned it off with all the little symbols for curse words, so I won't tell you actually what your first reaction is. But it is, oh no, it's anxiety, it's fear, it's I don't want that pain now. What will I say to the people who I'm supposed to meet in a couple hours? I don't want to go to bed. I don't want to lose more of my life. What am I going to do? How will I finish my project or pick up my kids? Or what will I tell the person that I'm about to go out? I'm not young enough for this, but for my kids in their 20s, I'm about to go out on a Tinder date. What am I supposed to tell that person I'm meeting? Or even just my friend who I'm canceling on for the third time. And with all of this difficulty with migraine, I then ask myself, why do more than half of people who suffer with migraines not get treated? Why? We're obviously the people getting treatment, but I'll tell you in a little bit, that wasn't always the case. And there are a lot of reasons, and you've been hearing them this morning, why people don't get treated. Sometimes people don't know these are migraines, even educated people. They may not have access to care, they may not believe in treatment, and there's a lot of overlap between mental health and migraine, a lot of stigma and shame, a lot of not believing, particularly in mental health, that treatment works. A lot of isolation. You become just so sick with migraine, how are you supposed to get to all these treatments you're supposed to go to? And then there's, you tell someone you have a migraine, and they say, oh, I have headaches, right? I have headaches, or it's just a headache, you can still go. So I am here to combat stigma and isolation, one family at a time. And this is the only slide I wanted to show because that's my mom and those are my daughters. And we have 5 people in 3 generations who have migraine with aura, actually. I'm going to turn it off because it's annoying. And so when my oldest daughter had her first very complicated migraine at age 8, and we're getting ready to go to the neurologist, and I asked my mother, Mom, do we have any migraines in the family? We don't have migraines in the family. What are you talking about? Took me a little bit. Remember those headaches you used to go to bed with for a couple of days? Those sick headaches when I was a kid? She said, oh no, those weren't migraines. That was my divorce. Thanks, Mom. That's really helpful. So it took me a while longer, actually, to go to the neurologist. And well, I get headaches, right? I get headaches. And you get migraines. Really? I had been through medical school at this point and residency and had been practicing medicine for 10 years, and I did not know I had migraines. And I've really thought back. I don't remember if it was Dr. Schulman or Dr. Kempner's slide. I don't know if I ever had a single class, a single hour on migraine in medical school. And it actually wasn't until almost 10 years later when my second daughter had very chronic, significant headaches and migraines that I started going to the headache talks myself, because I'm a doctor too. I live in a lot of worlds. And I learned that this necklace, very light little necklace, that I tried to put on this morning, and I couldn't even get from my bathroom all the way out to the kitchen before I realized it was triggering a headache, that was a symptom I had had for most of my adult life, and it had a name. It was called allodynia, and it was related to chronic migraine. And I'm a doctor who didn't even think that I had migraines until my kids got sick. So there are a lot of reasons related to both stigma that Dr. Kempner talked about and shame. And I'm just going to do the mental health piece really quickly and ask you, is your treatment working? Doctors don't often tell you what we have, and I decided today I would tell you that I have it, my family has it, and that whoever said it, almost all the doctors and researchers that I've met in this field, either they or their loved ones have migraine. And so we all need to start talking about what we have so that we can get the treatment we need. And the hardest question I'm going to ask you today is, how would you feel about a better life? If you could have a better life, even if you still had headaches, would you take it? Is it worth it? So that's why you come see a therapist or a psychiatrist, because our lives can be very, very hard. And what you want to be able to do is live the life you have and have a good life, even if it's a headache, even if it's a life with headaches. And it is also a headache, but even if it's a life with headaches. And so what else can you do to have that better life? One thing you can do is get treatment for the other things that you have. And they brought a psychiatrist here today so that I could tell you that we have treatments that work for depression and anxiety and for trauma. And treatment for these other disorders might make your life better. Very likely will make your life better. The easy part is for me to talk about SSRI antidepressants because the medicines for anxiety and depression are pretty easy. You don't need blood tests for them. They have some side effects, and they're the same. Anxiety and depression are treated by the same medicines, selective serotonin reuptake inhibitors. And so if you hear the names out there, Prozac, Zoloft, Celexa, Lexapro, those are those medicines. You should probably try 2 of them. If the first one doesn't work or gives you side effects, try a second. And I'm not going to tell you all the side effects now because you will need to be working with a doctor in order to get these medicines prescribed. Ideally, if it's not your headache doctor prescribing these medicines, your other doctor will talk to your headache doctor because we're looking for medicines that have more than one use. I do want you to know that SSRIs have sexual side effects, so if your doctor doesn't bring it up with you, by all means, bring it up with your doctor. We're doctors. We should be able to talk about those things. And know that I, as a psychiatrist, am not the doctor who most often prescribes antidepressants. Primary care doctors prescribe most antidepressants for mild to moderate depression and anxiety in adults. Now, I'm a child psychiatrist, and not all pediatricians will prescribe them. But primary care doctors prescribe them, headache doctors prescribe them, general neurologists prescribe them, and psychiatrists prescribe these medicines. If I had more than 20 minutes to do all of psychiatry, I would talk to you about doses, but you want to make sure that you take enough of a medicine that you're bothering to take, so don't worry about, oh, I just want to stay with the starting dose. But you may start a little more slowly because you are someone who is sensitive to both the effects and the side effects of medicines. SSRIs are the only medicines for depression and anxiety that have evidence in children and teenagers. So I've recognized some moms here from other events, and these really are the only medicines that we think work for depression and anxiety in children and teenagers, but they're not the only medicines that work for depression and anxiety in adults, and many of you will likely have tried the older tricyclic antidepressants because they can also They are established treatments for other kinds of chronic pain and can help with sleep, so they may not be the only ones you're offered. And then, especially in adults, there's a newer class of antidepressants called SNRIs. They work on norepinephrine and serotonin. The one most people have heard about is Cymbalta, the generic is duloxetine, that has evidence and some FDA approval in other chronic pain disorders. And quite honestly, when your pain system gets turned on, when you have chronic migraine, I won't have you put up your hands, but I know from working with the teenagers, when your pain system gets turned on, it gets turned on. And often people have more than one kind of chronic pain. So Cymbalta is a medicine that's increasingly used for both depression and anxiety and chronic pain. And it's not just because, well, we want to treat your depression and anxiety and that will make your life better, but also because pain, of course, can make you anxious, which leads to more pain. We know that when you are anxious, it heightens your pain. That gives you less life. That makes you more depressed and gives you more anxiety. This is happening biologically, physically in your brain, which increases your pain. And thus that vicious cycle of pain, anxiety, depression, more pain, more anxiety, more depression. So the depression and anxiety can worsen your pain, though for, I think, most of us here with migraine and for our headache specialists, we know that the original cause of your migraine is that you have a migraine headache disorder or a headache disorder, not that you're depressed or all of the other things that Dr. Kempner talked about. I also want you to know that I love treating anxiety. Most people who treat anxiety love it because anxiety responds so well to treatment. In most cases, we don't even start with medicine. We start with a kind of talk therapy called cognitive behavioral therapy. The idea being that your thoughts affect how you feel, your behavior affects how you feel. So if you can learn some new behaviors, some new skills, you may feel better emotionally as well, have less anxiety. And if you can learn some new ways to think. Most of us have automatic thoughts, and often those automatic first thoughts are negative. So if we can learn to challenge our automatic negative thoughts, think in more positive ways, more accepting and generous ways related to mindfulness, often that is very effective for depression and anxiety. And the combination of that cognitive behavioral therapy, CBT, and SSRI antidepressants is often most effective. Same exact medicines for depression and anxiety. There are good rules about how long to treat and how to stop. And what you want to push your psychiatrist or your prescribing doctor about is we're good at getting people somewhat better so that they're not suffering as much and they function better. What's harder is getting people really well. So if you're going to bother to take medicine and be in treatment, make your goal from the mental health perspective to be well. We can get you well with depression and anxiety, even in the face of headache, and even if we can't get rid of your headache disorder. Don't stop abruptly and don't do it on your own. You do have a sensitive brain, and you will suffer if you just stop these medicines abruptly. Treatment does not have to mean medication. It's talk therapy. It could be CBT, and there is good evidence for CBT in depression, anxiety, in migraine, for insomnia, for trauma. Trauma-focused CBT is a real thing. CBTI for insomnia. But CBT isn't the only kind of therapy, and if you are a mature practitioner like I am, you may not have a specific name for the kind of therapy that you do. What the research shows is that good therapy, no matter what you call it, has more in common than it is different. It depends on the relationship, the therapist, and you will know when a therapist is a good fit for you. Try to give someone 3 tries and then trust yourself. If someone's not a good fit, it's okay to ask for another psychiatrist or another therapist. Supplements have more evidence in migraine than in mood disorders or anxiety, but ask your doctor about it. If I could choose one symptom to treat before I run out of time, it would be sleep. And all of your doctors should be able to talk to you in a meaningful way about sleep. There are so many reasons you can't sleep well, because it's really hard to fall asleep when you're in pain and when you're anxious and worried, maybe related to your headache or not. And it's really hard to sleep when you slept all day because you had a migraine and took your medicine. So there are many modalities for helping sleep. Medicines, over-the-counter and prescription, cognitive behavioral therapy, and I'm going to skip the medical marijuana question that Dr. Schulman got because that's a whole other talk. And there's something called sleep hygiene, good routines, good practices before you go to bed, when you get in bed, and your doctor should be able to talk to you about that. And the one more thing you can do is exercise. Exercise is an evidence-based treatment for depression, for anxiety, and for migraine. Exercise helps with prevention of headache. And you may have to start very slow and very little, but if you can get yourself even to take a walk outside, that will help your mood, your anxiety, and perhaps even your headache. And I'm just going to, in a completely different way to the mindfulness talk, say, do what works for you. It could be mindfulness or relaxation or biofeedback or yoga or guided meditation. They have a lot of similarity. Take good care of yourself. The slide you're not seeing talks about eating and sleeping and exercise and relaxation and knowing your triggers. There's an acronym called SMART that captures all of that. Not all technology is bad. I think there's a handout around that shows you a lot of relaxation apps. And do what works for you. Don't be afraid to try new things. I'm a traditional Western medicine trained doctor. I tell my patients what the evidence supports, and then if they'd like to know, I tell them all the other things we've tried in my family, because there may be other things that help you besides traditional medicines. Don't keep your headache disorder a secret. That is the most important thing about being here today and why I showed you my mom and my daughters, because it's important that we talk about this with each other, with other people. It's nothing to be ashamed of. And I especially want to thank Miles For Migraine, because not only do I work for them and do some volunteering, but Miles For Migraine really works for me, because I get to be out there, be with other people who have headache and not keep it a secret, and know that we're turning something that's very, very difficult and challenging in our lives into something really, really positive. And turning something bad into something good, there's a lot of healing in that. So, thank you. Post-traumatic headaches. Is it a specialty? Chronic pain. Post-traumatic headaches. So I don't know who wrote the question, and post-traumatic headaches mean two different things, and I'm not sure what you're thinking. So when I think of post-traumatic headaches, I most often think of concussion. And post-traumatic headaches following concussion are very much a real thing. When I work with the teenagers who I've talked to more, an awful lot of those kids who are coming in for chronic migraine have had concussions. And we know the veterans, the soldiers, that post-traumatic headaches are one of the most significant and disabling symptoms that they come back with. And I think what we're discovering in migraine research and headache research is that not all headaches are the same biologically, and not all headaches are migraines. So it is, I hesitate to say it's a separate specialty, but it may very much be different than a regular chronic migraine. That's true of other kinds of headaches as well, though. There's something called new daily persistent headache. Some of you may have woken up more or less on one day and gotten a headache that never went away. We treat those headaches like migraines because those are the only treatments we have, but I don't think we know yet biologically what a new daily persistent headache or a post-traumatic headache is, but the treatments are the same. If what you meant were headaches related to other kinds of trauma and PTSD, post-traumatic stress disorder, certainly people who have had other kinds of trauma have a higher incidence of migraine and chronic headache as well. And I think that really relates to the fact that people who tend to develop PTSD often have pre-existing anxiety. They're more vulnerable to it. And so you get into that cycle of people who are biologically more vulnerable, more sensitive, and so develop more symptoms. And there is good psychiatric treatment for post-traumatic stress disorder if you've had trauma in your life. And if you have chronic migraine and have had trauma, early trauma abuse, I strongly encourage you to get the mental health treatment you need for the trauma PTSD. And you will then see what impact that has on your headache, but both treatments are equally important. I hope that answered your question.